Hemoglobin estimation. Hemoglobin is an important constituent of RBC. It carries about the important functions of transportation of oxygen from lungs to various parts of the body, and it also transports back to carbon dioxide from the body to the lungs. Hemoglobin constitutes of two components, heme and globin. Heme is a combination of iron and protoporphyrin, and globin is a protein formed a amino acid chains. For men, normal value of RBC value: men RBC 5 to 5.5 million per cubic millimeter, HB 13.5 to 18 grams, PCV 40 to 54. For women, RBC 4 to 4.5 million per cubic millimeter, HB 11.5 to 16.5 grams, and PCV 35 to 47. Infants, RBC 4 to 5.6 million per cubic millimeter, HB 13.6 to 19.6 grams, PCV 44 to 62. Children's 1 year, 3.6 to 5 million cubic millimeter, HB 11 to 33 grams, PCV 36 to 44. 10 to 12 years, 4.5 to 5.2 million cubic millimeter, HB 11.5 to 14.8 grams, and PCV 37 to 44. Blood specimen. The capillary blood are used directly if vein blood is used. EDTA or heparin or double oxylated anticoagulant are used. There are various methods for distribution of hemoglobin. The salicylic acid hematin method. The HB is converted to acidic hematin by the action of hydrochloric acid. The acid hematin solution is further diluted until its color matches exactly to that of permanent standard comparable tube. HB is read directly from the graduated tube. Procedure: fill the HB cylinder up to the lower mark with 0.1 normal HCl solution. Added 20 microliter 0.02 ml blood with the help of salicylic pipette. Make sure that there is no air bubble inside the pipette. May mix the blood with HCl which is already placed in the cylinder. Take care that there is no blood left on the side of the cylinder. Rinse the pipette twice in the blood solution. Allow it to react for about 10 minutes till the solution becomes dark brown in color. Add acid hematin is produced in the cylinder after combination of HB and acid. Dilute the solution by adding drop by drop of distilled water until perfect match is obtained with the standard comparable tube. Read the HB concentration directly from the level of diluted solution. The reading may be percentage or grams per liter. Colorimetric method of HB. It is also known as a hemoglobin method. Principle: a small quantities of blood is taken and allowed to react with potassium cyanide and potassium ferricyanide. Dworkin's solution. The chemical reaction gives product of stable color. This product is called as a cyanomethoglobin. The intensity of the color is directly proportional to HB concentration. Equipment: the colorimetric with the green filter, 540 nanometer salicylic pipette test tube. Reagent: Dworkin solution, cyanomethoglobin standard solution. Composition: potassium cyanide 50 mg, potassium ferricyanide 200 mg, distilled water 1000 ml. Store in dark bottle at room temperature. The standard solution with HB content of 5 grams, 10 grams, 15 grams is recommended. Procedure: take 2 test tube and label it as a blank and test solution. Add 5 ml of Dworkin solution in each test tube. Avoid mouth pipetting as Dworkin solution is poison. They stopper the tube with a rubber cap. Add 0.02 ml of blood sample into the tube, mark with a T. The sample is then with the help of salicylic pipette. Wipe off the tip of the pipette before adding blood into the test tube. Mix the content of the tube and wait for 10 minutes with the help of a blank and standard solution. Find out the absorption of the test solution in colorimeter at 540 nanometer. The hemoglobin can be calculated as hemoglobin is equal to absorbance of test solution into concentration of standard divided by absorbance of standard. Specific gravity method. Principle: when a drop of whole blood is dropped into the copper sulfate solution with a particular specific gravity, the density of drop is directly proportional to the amount of hemoglobin in the drop. If the drop is denser than the specific gravity of the solution, the drop is settled down to the bottom. If not, it will float on the top. Procedure: the copper sulfate solution of specific gravity 1.055 for male and 1.053 for female is taken in two test tubes. The specific gravity corresponds to minimum Hb level for both respective sexes. 1.055 specific gravity corresponds to 13 gram per deciliter. The hemoglobin in specific gravity 1.053 corresponds to 12 grams per deciliter of hemoglobin. A drop of blood is collected by skin puncture and taken into a long necked patcher pipette, and then immediately drop the blood into the proper copper sulfate solution. Observed for 15 to 20 seconds. If the person is normal, the drop of the blood will settle down, and if the person is anemic, the drop will float on the top. This test does not give the exact amount of hemoglobin. This technique is usually applied in blood banking for screening the dose. It is quick and easy, accurate technique. Gasometric method. In this method, the Van Sickle apparatus is used for gasometric determination of hemoglobin. In this method, blood is first of all saturated with oxygen. Then oxygen is taken off and collected. Depending upon the amount of oxygen collected, the amount of hemoglobin can be calculated. For 1 gram of hemoglobin, 1.34 ml of oxygen is present in the blood. Chemical method. In chemical method, the hemoglobin is found out by finding the amount of iron present in the blood. The amount of the iron is directly proportional to the amount of hemoglobin present in the blood. Clinical importance. Decrease in hemoglobin concentration below the normal value is a sign of anemia. The hemoglobin concentration is lower in adult female than in adult male. The hemoglobin value are lower during the pregnancy due to the hemodilution. The children have low Hb. An increase in hemoglobin concentration can occur due to the hemo concentration, like loss of body fluid in case of diarrhea and vomiting. In case of reduced oxygen supply, like heart disease, the polycythemia, Hb is low. Decrease or increase in concentration of Hb should be reported as it is a sign of disease.